Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the disconnect between the government's claims and the reality of healthcare in England as the NHS begins the worst winter in its history. A result not of external factors, as the government claim, but a deliberate campaign of undermining the NHS for over 10 years. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So the news is very grim regarding healthcare in England right now. The mainstream media are telling us that there may be 500 unnecessary deaths a week as a result of shortages in our healthcare capacity. 500 deaths a week that would not be occurring if people could access healthcare that they needed. The healthcare that they could access when Labour in power, for example. The government are claiming that it is COVID that's caused the problems. This is demonstrably untrue for a couple of reasons, albeit that yes, COVID is on the rise. But first, if you are going to claim that something is due to a global factor that is out of the government's control, it should affect others as well. There are no reports of failing healthcare in Germany, in France, in Italy, in Poland. People needing access to healthcare there get it. Now, if the government want to blame their continued cack-handed approach to the pandemic, sure, why not? But they do not get to claim that it's due to something international that is out of their control when the other major economies of Europe seem to be able to manage well enough. But the second reason is that we had these winter crises before the pandemic. Yes, it's much worse now in scale, and yes, COVID rising is part of that. But the problems are nothing new. During the 2019 general election campaign, for example, which occurred in December, there were reports in the newspapers of patients being left on hospital floors. Because not only were there not enough beds, there were not always enough trolleys to even leave them in a comfortable position in the corridors. So on the floor they go. Yet people still voted Conservative, believing Johnson's lies about the new hospitals and the brilliant new NHS. Throughout the history of the NHS, it is always Labour who renew it. The Conservatives destroy it, Labour renew it. You know, there have been some graphs bouncing about from the Financial Times of late. I'll be using them again, multiple times I expect. But this one shows government spending on healthcare as a percentage of GDP. All pretty flat under the Conservative government of Thatcher and Major, a bit up and down, but basically flat. Then under Labour, it's like almost vertical. Takes off. Then it goes down when the Tories come back into power. Now, I'll also point something else out. The grey lines behind the blue of Conservative and red of Labour. They are the other major Western economies. Now, what you can see is that when the Tories have been in power for a while, the UK has amongst the lowest investment in healthcare anywhere in Europe. When Labour came to power, it went from the actual lowest to one of the highest. But you can also see it took a long time to do it. Didn't happen overnight. Couldn't happen overnight. And it can't happen overnight next time. For any bonehead still thinking it makes no difference between Labour and the Conservatives, look at the pissing graph. And there are loads like this. Makes all the difference in the world. But the government refused to accept that the NHS is in crisis. A spokesperson for the government was in an interview. Was it yesterday or the day before? I can't remember. I think it was yesterday. And it was a spokesperson, by the way, because the Prime Minister and the Health Secretary are hiding. They're refusing to do interviews. They're not going to hospitals either. They're not doing any photo opportunities in hospitals. They are staying well clear. But this spokesperson said that the NHS faces a challenge, but it's not a crisis. 500 avoidable deaths a week. People being told, the government are telling them this, that they might not be able to get healthcare this winter. Some people in this country may not be able to get healthcare this winter. That is what the government is saying. That is a crisis for any advanced economy. In fact, it is a state of deep national shame. Anyone in this country not ashamed of this has no bloody shame at all. And there are so many indirect issues with this Tory squeeze as well. There was an article in The Guardian today. An 11-year-old severely disabled boy needs round-the-clock care, qualifies for NHS support for this round-the-clock care, but that support has been withdrawn. Reason being the parents cannot afford to heat and light the house. Now, fair enough, not fair to ask nurses to endure freezing cold conditions as they work, but that boy's NHS care has been withdrawn because the parents cannot afford the cost of energy. It is worth pointing this out because it shows that the Tories aren't just brutally targeting the NHS for destruction, but society itself. I know there's the much touted phrase from the Thatcher era, no such thing as society. I don't actually know if it came from her or not, but it is certainly the mission of the Tories to dismantle society whenever they get the chance, just like they dismantle the NHS. And how have the Tories abused the NHS to the point where people cannot even be guaranteed to get emergency healthcare now? Two main ways. The first was to remove funding. Obviously, they have to claim that they're pumping ever larger sums in. They're not. The real terms funding for the NHS has gone down in two ways. First of all, it has been reduced in real terms funding and in terms of GDP, as we can see from the graph. In terms of the value in pounds, it looks like it goes up, but you have to take inflation into account. And when you take inflation into account, which the government and the media never do, it has gone down. But it has also been reduced by using more private healthcare when it wasn't necessary. Now, I was always a little uneasy with Blair's use of private capacity for the NHS, but when it was just adding capacity to get rid of the waiting list, that's fine. I'm okay with that. And the next Labour government's going to have to do the same thing. People are going to moan, but what they'll be doing is getting rid of the waiting list. What the Tories have done is something completely different. They replaced existing NHS provision with private services at greater cost. And because it costs more for private provision, what little funding the NHS do get results in less healthcare at the end of it, because a lot of it's going into profit. And the second way they undermined the NHS was to literally break it up. The NHS was split up by Cameron and Osborne into lots of different parts, which are now overseen by people with a commercial interest in healthcare. So the decisions made by these smaller bits of the NHS around England, their operational decisions are being decided by, or partly by, people who have a commercial interest in certain decisions being made. Makes the whole system way less efficient and tilts the whole system towards healthcare funding going towards profit and not healthcare. It was a deliberate scheme to make it harder to link up provision around the country and therefore harder to service people. And we can see the impact now. The government and their client media are trying to use the crisis as evidence that the NHS model doesn't work. But the government are not using the NHS model. It worked when Labour were in power. Now, there is, of course, an extent to which you will need to keep modernising a system. You know, as wealthy countries like the UK develop ever older populations, more people living longer and therefore into retirement, there's going to be a greater proportional demand for health and social care. Absolutely. But other European countries have got that same issue. Not only have they got COVID, they've got an ageing population as well. The exception is that they don't have a Tory party winning election all the time. Because that's the common factor to our problems. When the Conservatives are in power, we suffer from poor public services, including healthcare, where other comparable countries in Europe do not. When Labour are in power, all of a sudden they seem to get a lot better, as if by magic. But it's not magic. It's putting your tick in the right bloody box. The cost of a Conservative government isn't just living in a more uncaring society or struggling more than you should have to. That is the case for some. But it's people dying. People dying when their loved ones know it shouldn't be happening and can do nothing about it. Dying because the ambulance that they called doesn't get there. Or because there aren't enough beds in the area. Maybe even dying because they've seen the news about trying to avoid putting extra stress on the NHS. So they'd normally seek medical attention for something and then they don't. And then they die because they might have concussion or something. And they should have medical care. You know, the government are claiming that the NHS has enough funding to cope, but they're also admitting that not everyone will be able to access healthcare this winter. If you cannot give people access to the healthcare they need, including emergency healthcare, in one of the wealthiest countries in the world, it's because you're making a political choice to deprive them of it. And we know that because other countries can provide it. Some don't. The United States, for example, makes a political choice to deprive people of it. But countries in Europe don't. They provide it. The government also don't get to claim that the funding is there when a quick look at, again, another chart, Financial Times again. Little international league table by hospital beds shows us behind everywhere else in Europe. We're beating Colombia though, don't worry. Now, number of hospital beds per capita is not itself a measure of effective healthcare. Like if a country is really good at the prevention and has low levels of serious illness, for example, doesn't need as many beds. So you wouldn't just look at this in isolation. But at the moment, we don't have enough hospital beds. That's a fact. No one denies that. The reason why people cannot access healthcare is because hospitals do not have the beds. So we don't have enough beds, right? So the government's saying, but there's enough funding. But then you see, but hang on a minute, we've got fewer beds per capita than all of the major economies in Europe, by a long way in many cases. So no, when we've not got enough, if we had enough beds, then you wouldn't look at the number of beds. But if we haven't got enough beds, the government are basically saying, well, we can't get more. It's like, no, you can't say that because other countries can and have. But anyway, there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.